And now it's time for Half Hour to Health. Sit back, relax, and find out how you can live a better life. Here's your host for Half Hour to Health, Dr. Stephanie.
Good morning and welcome to Half Hour to Health. I'm Dr. Stephanie from Crossroads Chiropractic, and I'm joined today by two very smart, intelligent, and fit people. They are the founders of the Gym Doctor app. Today with us is Dr. Sohaib Siddiqui. He is a family physician practicing old school medicine with new technology as well. He owns and operates Cranmore Health Partners and a multi-specialty medical practice with primary care, urgent care, interventional pain management, embedded dietitian, in-house pharmacy, physical therapy, and podiatry starting in March of 2022. And also joining us is Rocco Boulay. He is the CEO of Integrity Health. He's an exercise physiologist and also the WPA World Bench Press champion and the founder of the Integrity Health Coaching Program. Thank you, gentlemen, for being on the show today.
Well, thank you for having us, Stephanie. We appreciate being on.
So tell us.
Thank you, Stephanie.
Oh, you're welcome. Tell us what the Gym Doctor app is and why was it created?
Well, it's still in design and in testing right now, so it's not actually released yet. But the whole platform was designed to be able to give not only practitioners but average everyday people, we'll call them patients, members, whatever the case may be, the ability to be able to search out and find the best provider for their particular situation. But we're also trying to bridge the gap between fitness and health and medical. As you probably know in your business, that a lot of the people that we service are suffering from conditions caused by lack of activity, poor food choices, and smoking. Mm-hmm. And Dr. Siddiqui has been one of those pioneers who's seen the issue and wanted to jump on board with us to create this new program so that regardless of whether you have a health issue or a medical issue, we'll be able to put you in a network of members that are like-minded that will be able to help you in the best way possible at a price that probably is second to none. That's
amazing. Now, when do you expect it to be released?
Well, our goal is to start beta testing this month. We have a bunch of programmers working on applications that work both on the iOS or the Apple platform, and we have the Android platform, and we have an app that works for the practitioners and also the app for the users. So it's a pretty good program and a pretty big application to build. But we're hoping to start beta testing this within the next week or so.
Oh, that's exciting. So what led to your desire to bring about this app? Like, where did the idea come from?
Do you want to answer that, Doc, or do you want me to answer that one?
Sure. Rocco and I are kindred spirits. We met because he owns multiple gyms and health centers, and right next to my clinic, and we just became friends, and we started speaking about, bringing together traditional medicine and the exercise physiologists, the trainers, because right now, as you know, everyone is like working on these little silos, which is worse now with the COVID. You might see a patient as a chiropractor. They might not know that they might be obese. They may not have not seen a dietitian before. They might not have had even the primary care doctor talk to them about how to lose weight, how to get more healthy. Metabolic problems are huge in America and elsewhere. And with the COVID, it's worse now because for the last 2 years, people have become couch potatoes. And some people have gained weight, they're unhealthier. So this is like a huddle approach is the best way I explain it. I'm a hospitalist as well, so in a hospital setting, every morning we meet at 9 a.m. and physical therapy is there, the dietitian is there, the respiratory therapist, the doctor, the specialist, and we all speak about the patient together as a team. So that team-based approach, which is is what we were shooting for, which is what we're shooting for right now. I think over time there'll be refinements to it, but right now there's nothing like that in the outpatient world. Most people will see their primary care doctor who will know what's going on with all the other medical needs, but sometimes they don't, because people are seeing so many different doctors these days and so many different specialists. So it's to try to get everything into one platform. So, and this platform will allow us to do telehealth, which is the future. It's here, but I think it's going to get bigger in the future. Plus, it'll have people like Rocco and exercise physiologists, trainers. We need that because they have expertise that we don't have. I was telling Rocco, in medical school, our education for nutrition or exercise is about a week, and that's it. Rest of the time we're talking about other stuff. So it's a big knowledge gap there, which we need help from the exercise physiologists and the trainers and chiropractors, physical therapists. We don't know everything. So I think we combine all this together, you might have a good, better job of taking care of the patient.
It sounds like it's filling a huge void that maybe people haven't even recognized is a void.
Yeah, not only to mention, we're trying to incorporate the fitness centers as well to become metabolic therapy centers, because one of the bigger issues, especially with COVID, where people were suffering the greatest consequences that had, visceral abdominal fat, and being able to help people understand how to remove some of that fat, how to increase their immunity against not only COVID-19, but every other virus and every other antigen that's out there, pathogen that's out there that could possibly cause them harm. And the fitness centers, we have 38,000 fitness centers in this country, and yet we're the most obese nation on the planet. There's a disconnect there, and what we're trying to do with Gym Doctor is to be able to help the doctors be able to refer to our health coaches and our trainers to be able to provide all the necessary exercise and nutrition support to those people utilizing the fitness centers across the country.
So what do you think is making us so unhealthy as a nation?
One word: sugar.
Yep.
It's sugar.
Joy.
So, if I could give anybody, I'm writing a book right now called Getting Things Off My Chest, and it's about how the fitness industry and the medical industry has never been connected, and my frustration with that. And I think I'm writing 3 chapters in a row that says, what's your problem with your health? And that chapter will be sugar. The next chapter is just going to say sugar. And the chapter after that's going to say sugar. and then I'll go on to other things. But the reality is, yes, of course, lack of activity is playing a huge role. But if people just cut sugar out of their diet to begin with, we would have a lot healthier of a nation.
Mm-hmm. Yeah, I've said that you can't exercise your way out of a bad diet, especially with the amount of sugar the average American consumes.
Definitely.
And it's true. And because it's a subsidized product, and people who are in low-income families, that's basically what they eat, and it's just driving the situation further and further into debt, and why our healthcare system is failing for the most part. And we need to do something to make the practitioners and the patients accountable for their health outcomes, and we haven't done that yet, and we're hoping to kind of make this happen through the Gym Doctor application.
So talk to me about how you can go about eliminating some of the sugar from your diet. As if I wasn't aware, but for the listeners, what are some basics? Basics
would be to eat lots of high fiber vegetables, especially, and when you're eating a meal, eating things that contain lean proteins and good fibrous types of vegetables, fruits that are low glycemic, such as mostly your berries, your blueberries, blackberries, strawberries, things of that nature. Apples are very low glycemic types of fruits. I always find that when I am interviewing somebody about putting them on some kind of a special nutrition plan, I'm trying to eliminate the sugar, and I tell them they can eat fruits and vegetables, the first thing they ask me is, well, what about bananas? and it's because it's probably the highest sugar fruit that's out there, and they're trying to You're trying to curb an addiction that they have, which is addicted to sugar.
Mm-hmm.
But if you fill your body up with healthy foods first, and then start to maintain good, healthy blood glucose levels, eventually your body readapts to the new blood glucose levels, and you don't crave the sugar as much. But it's a withdrawal process, just like almost every other drug that's on the planet.
Is there any way to make that withdrawal process easier?
In my own opinion, I think that eating on a regular basis and never letting your blood sugar levels get low enough where you start spiking, where you start getting insulin levels that are up too high and then creating these spikes, because you're going to crave sugar when you're hungry. But if you're not hungry, you're never going to crave sugar. So if your body's maintaining a good, healthy blood glucose level throughout the day, then you're not going to have those cravings. So that would be my one suggestion, without recommending any type of supplement. And I won't promote this on a radio show, but there are some supplements out there that may help with that, but I'm not going to get into that.
Okay, that's fair.
And if I can just add on to what Rocco was saying, our traditional diet, breakfast, lunch, dinner, is based on 1800s when we were farmers. Most of us are not farmers anymore. And going back to what Rocco is saying, and correct me if I'm wrong, Rocco, but having more frequent meals, maybe even up to 6 a day, smaller meals, are better to kind of control those sugar cravings as well, from what I understand from the physiology world.
Mm-hmm.
Well, it's true that the quality of the food that we ate in the 1800s versus today is quite different as we have production of these foods. We have 7.5 billion people on the planet now, so trying to feed these people has become an enormous challenge for the food industry as well. So obviously trying to keep the cost down has created part of the problem. But in reality, what we need to do is we need to replicate what Dr. Siddiqui said, the actions and the exercise of, 100 years ago and the foods we ate 100 years ago. That's one of the things we're going to do with our platform as well, because when we designed resistance training programs in the facilities for people who are suffering from obesity or diabetes or any other of these metabolic disorders, we're trying to get their muscles to be able to utilize glucose the right way, but also we're going to help them understand what types of foods they should be putting in their body. So we will give out sample meal plans based on caloric needs from 1,000 calories all up to 3,000 calories in 200-calorie increments, so they can have an idea of what their daily feeding should look like.
Well, this is an all-around approach to improving people's health and helping them recover from metabolic disorders. We're talking today with Dr. Siddiqui and then Rocco Boulay, the CEO of Integrity Health, the founders of the new Gym Doctor app, which is coming out soon. We've got to take a break, but we will be right back here on Half Hour to Health.
And now back to Half Hour to Health with your host, Dr. Stephanie from Crossroads Chiropractic.
Welcome back. You're listening to Half Hour to Health. I'm Dr. Stephanie from Crossroads Chiropractic, and today I have the founders of the Gym Doctor app, Dr. Siddiqui, who practices in North Conway. He's the president of the medical staff of the Memorial Hospital there, and Rocco Boulay, he is the CEO of Integrity Health and the founder of the Integrity Health Coaching Paradigm. Thank you, gentlemen, for being with me today. I'd like to hear more about how the Gym Doctor app is going to create a community of providers that's able to help people that are dealing with metabolic disorders.
So, one of the big things that we're shooting for is signing up providers, and they'll have their own section in the app and on the website. We're developing all three at the same time. So the provider will be able to log in, just like you log into any, like a bank, et cetera. You'll be able to log into the app, see patients via telehealth, also be able to converse with other providers if need be, through chat or text. So let's say I'm seeing someone with low back pain, they're overweight, they're trying to lose weight, they have some arthritis as well that's occurring. I can see them via telehealth, but then I can also reach out to my chiropractor friends or my physical therapists in the area and say, hey, I am seeing this patient. Can you see him also? this will, for the provider, will drive business into their brick and mortar offices, but it'll also give us access to patients who are still afraid to go to the brick and mortar office because of COVID, or some people are just afraid of doctors. White coat syndrome is very common. There's a reason most of us don't wear white coats anymore. Because we don't want, and a lot of doctors, these days, when you go to their office, their patients will call them by their first name. 30 years ago, that was not they would look at you funny, but these days it's normal. So I think medicine is changing over time for the better. But we need to have a collaborative approach. Without that collaboration, it's very hard for one person to do everything. So you need you need the physical therapist, you need the chiropractor, you need the dietitian, you need the exercise physiologist. And this platform is the only one that I know of and Rockland knows of that is going to have all that in one spot. And our goal will be to have doctors enroll with us and over time build their practices too. And that's always a good thing too, to provide better health care to patients. Some patients are afraid of going to the clinic, or they're afraid of X, Y, and Z. We want to get rid of those barriers.
So one of the things that is exciting to me is this is providing an opportunity for doctors that maybe are leaving the hospital systems or bigger practices to be out on their own and provide individualized care that's well-rounded to community members.
Yeah. Oh, yeah. And the startup cost is very little because you can do this out of your home. You need basically a computer, and and we all have that. So, telehealth, I think, is the future. It was kind of forced upon us because of COVID, and I think it's going to keep growing in the future. Most providers now like it. There's some things you have to examine the patient, if it's surgical, et cetera. But even those cases, sometimes the follow-ups we can do via telehealth. So I think it's going to be a game changer. There are many telehealth companies out there, but what they're doing is just having either a nurse practitioner or a physician assistant. They treat like little things like upper respiratory infections, stuff like that, via telehealth. But they're not doing anything beyond that. And so what we're building is way beyond what the establishment has right now.
So, Rocco, can you tell us a little bit about how the exercise programs are going to factor in for people?
Sure. We are actually still going to incorporate the Easy Coach training system that I think you're a little bit familiar with, that we've been massaging into this quite a significant program over the years. But the best part about incorporating Easy Coach into the gym doctor system is that each person, instead of getting a one-size-fits-all fitness program, we're able to evaluate the fitness capacity of the individual on a submaximal level. In other words, be very non-invasive to find out where they are and give them the training necessary so that they can build cardiovascular fitness, but also, more importantly, which has been kind of the X factor in fitness for the longest time, and the reason why many women decided to go through the cardio route versus resistance training, because they didn't want to feel stupid exercising with resistance or with weights, and we're basically taking that out of it. So people, especially who are suffering from metabolic disorders, they benefit greatly through increased lean body mass, because it re-educates how the glucose is being metabolized in the body versus somebody who doesn't have fast twitch or fast glycolytic fibers that will actually use that glucose in a much more efficient way than actually doing cardiovascular exercise. Besides that, if you're a 300-pound person on a treadmill, can you imagine what kind of force that is on the joints day after day after day, trying to lose, say, even 20 pounds for that matter? You're going to fail long before you reach your goal, and that's the reason why resistance training and building lean mass, which will burn calories 24/7, and you can basically do it sitting down on a machine, is much more it's much more logical to help people that way versus getting them up and pounding on their joints.
Mm-hmm. Now, will people be able to choose their own gym, or do people have to go to one site to find help?
We're going to provide fitness centers with the option of being able to be in our network. And if they don't want to be in our network, we'll also let people know, because we're going to actually do reviews and ratings on not only our practitioners, but all of the fitness centers that will be actually being used as metabolic treatment centers, because once that happens, they actually become a viable business. In other words, we can not have them shut down during, things that happened this last time that were non-essential. Well, if you're helping build immunity against a particular type of virus, well, you are essential. We should never have been shut down the first time. There was no evidence to even show that gyms were a bad place to go that were any different than Walmart or Home Depot, for that matter. So in this particular case, we're going to help people be more educated on becoming healthy and strong and build immunity, because resistance training actually increases the effectiveness of killer B and T cells in your body. And that's an important thing. It's probably more effective than wearing this mask. So I'm not saying you shouldn't wear a mask. What I'm telling you is that if you build your immunity first, that's the best mask that you can have.
Yes, sitting on your couch for a year and a half wearing a mask did nothing for your immune system.
Absolutely. No, it did. It actually weakened it.
It tanked it. Absolutely. Oh. So COVID has definitely brought about struggles for us in every aspect of life. And one of them was just staying active and fit. And I think we also saw the negative effects of not making connections with other people, perhaps the negative effects of trying to avoid going to the doctor's office or the hospitals for any needs that are outside of COVID, just for fear of COVID. Like, I think as a society, we are a lot less healthy than we were 2 years ago. Not to say that 2 years ago we were healthy by any means, but I think we've just gone to a worse place, if that's possible. So I'm really excited that you folks are working on the Gym Doctor app that is going to put people paired with providers that can help them overcome metabolic diseases, which really the metabolic disease affects all aspects of your body. So in the last couple of minutes, can you just talk a little bit more, maybe with the physiology of how metabolic diseases, being overweight, being obese, affects all aspects of your health?
Do you want to take that, Doc, or do you want me to take it?
Yep, sure. A lot of people, whenever I see a patient in the clinic, and we sit there, we talk about all these numbers, and it's a big jumble in people's brain. A1C, LDL, HDL. What does all this stuff mean? Metabolic syndrome. I try to tell patients, keep it simple. If your cholesterol is high, if you're diabetic, you have high blood pressure, all these things, and plus being overweight or obese, and these new things down the road. And that's what we're trying to prevent. We take our car every 3,000 miles for oil change, tune-up, spend all this money on our cars. We just keep an eye on our fluid, so to speak, and that's where metabolic syndrome comes into play. If you prevent metabolic syndrome by lowering your sugar, by lowering your cholesterol over time, by exercise and by speaking with a dietitian, with the physical therapist who, if you might be working out and have like shoulder pain, our gym doctor would be the platform that you can reach out to all these different people and providers and have a consistent message of and recovery and treatment. So, and you can do that in the comfort of your home even. So I think it's going to be a big, what Rocco says is famous saying is paradigm shift, and I agree with him, because it is a paradigm shift, and it's going to take time to educate the population, because right now people still think of gyms as gyms and doctors' office as doctor's office, but not as a combination. So, but I think over time, if even 1% of the population we can prevent metabolic syndrome, that decreases the death rate significantly. And so that's what our whole purpose of all this is preventive medicine to prevent anything down the road.
That's
I don't want to have a stroke when I'm 70 or 80. I don't want any of my patients to have that. So this is the time to fix it, or anytime, even as we're older. If we don't, then we're not doing our jobs.
Well, you folks are definitely doing your job, and I can see that this is going to make a huge impact on people's health, not just here in New Hampshire, but across the country. Thank you so much for being on the show with us. Until next time, we wish you a healthy, happy, wonderful weekend. We'll see you next time here on The Pulse.
You've been listening to Half Hour to Health with Dr. Stephanie from Crossroads Chiropractic. Be sure to tune in next week, right here on The Pulse of New Hampshire.